Funding for this program made possible by Kosair Charities, Dockyards Bank and Trust, Friends of Artisans Guild, Selma's Catering and Events, Southeast Printing and Mailing, Bluegrass Community Foundation, Civ Choice, and Rotary Club of Lexington.
Hello everyone, and welcome to Know More, the educational television series that takes a look at what life would be like without the nonprofit services in our communities. In this episode, we will be taking a look at agencies that are helping keep Kentucky healthy, that you voted to have featured. To kick us off, we're at the Midwest Open in downtown Lexington. We have David Collins here to enlighten us as to exactly what that is. David, I see people on bicycles, people with sticks with cups. What's going on?
This is a sport called bicycle polo, and the purpose of it is a lot like the rules of hockey, where you have 3 people on 3 people, and the goal is to score points by hitting the ball into a goal. This is actually called a mallet, and it's a tool that you use while you're riding your bicycle to control the ball and to score the goals.
Okay, well, of course, our show, as I mentioned, is about health. Is this a healthy sport?
This is absolutely a healthy sport. You spend about 5 different segments of 10 minutes riding your bicycles per match, and it's going to be pretty strenuous aerobic activity, which is going to definitely help with exercise.
And is there a certain demographic that plays this sport, or is it for everybody?
We have no requirements on demographic. Anybody can play. We've had kids as young as 10 years old playing, and adults as old as 65 even.
Wow. Well, we look forward to seeing more on the bicycle polo. Our first story is a Kosair Charities project helping prevent child abuse in Kentucky. We're going to learn about the health impacts of child abuse and how we can better recognize the warning signs. David, would you like to lead us into that?
Absolutely. Let's take a look.
My involvement first began in 2008. My son, who just turned 4 months old, was in the ER at Kosair, had a broken arm and a broken leg. Dr. Curry came to our room at Kosair and said, "I've got some good news and I've got some bad news. The good news is you get to go home with your baby. The bad news is there's a history of abuse with your babysitter." How did I not know this? I'm his mom. How did I not know? And I didn't. Why didn't anybody tell me? Why didn't you tell? How are we going to stop it? How are we going to make people aware?
Kosair Charities was the first and has been our most steady partner, collaborator, and funder. And they decided they were going to use child abuse as their primary issue to target.
By helping lead this great new Face It coalition, we can actually advance their efforts. We can have more and more people come together and more people try to change the life of a child for the better.
We have a child advocacy center where the child comes in, and it's a very child-friendly, child-focused environment. And we work with the children to find out exactly what happened to them. But child abuse is a huge issue. It just doesn't affect the child, it doesn't affect the family, it affects the entire community in a lot of different ways. And there's no one organization, including state organizations, that can really do this job by themselves.
And so what Face It does, instead of shunning child abuse, it's really important that all these partners are coming together, being in the public and saying, we are all behind this. This is a community-wide issue. We can all work together and we can all be the face that ends child abuse.
We believe if we all come together, all of us that in some capacity serve children that have been abused, that we can prevent the child deaths that just seem to be growing every year.
It's a scary thing to suspect that something's going on with a child and that I'm going to report it, and what if I'm wrong? But people need to get over that and realize that children can't pick up the phone themselves and make those phone calls, so we have to be their advocates and act on their behalf.
The children who are at the highest risk of dying from child maltreatment are those that are under 4 years of age. So it's our youngest children, and specifically our pre-verbal children, those who aren't able to talk yet.
Their brain chemistry is changed drastically, which means they're not able to concentrate, they're not able to learn in the same way in school.
All of those adverse childhood experiences directly increase our chances of developing a really significant number of health consequences. But there are also ones that we never expected to find, like cancer and heart disease and high blood pressure.
So on the prevention side, we know that when families can get out and be physically active, when they can bond together and get some of that stress or energy out, it can really make the overall family more healthy, both physically, but really in the emotional health as well.
This will save lives. This will save lives from the aspect of life and death. This will save lives from people going to prison. It will make a greater impact than just that one child.
I think about it every day. I think that Jake would probably still be in a bad situation. I think there will be a lot of lost children, and I think even my son may have fallen under that.
Without a strategic plan to address child abuse, it'll continue to get worse. Kentucky has for a long time been the worst in terms of child abuse in the nation. 280 children in the last 10 years have died from child abuse. And if we don't make a strategic, targeted effort to stop that, it'll continue to get worse and worse.
A world without all these organizations, without people that care about kids and are working hard to make their lives better and to keep them safe and secure and to see that they're educated, it would be a very dismal community.
I think this campaign, I know this campaign is going to save more lives and it's going to prevent more abuse from occurring.
We're looking at educating even pediatricians, police officers, school teachers, more of these people who interface directly with children, what to look for. Perhaps we can stop some of the abuse before it ever happens.
We think that we can change. There's a great opportunity to make a difference in the lives of future children if we all stay together. And we've made that commitment. We're not going away. We're going to deal with this problem.
To have a commitment and a collaboration among so many different partners from so many different backgrounds is tremendous. And in my mind, it's unprecedented.
It doesn't matter who you are, where you live, whether you have an education or not. Child abuse happens, and you have to face it. It's real.
Our next story takes us into the mountains of eastern Kentucky, where once upon a time, over 80 years ago, women would saddle up and ride off into the mountains to deliver babies. Though healthcare has advanced, those roots are what form today the foundation of Frontier Nursing University. Let's take a look.
There is a high need for nurse practitioners and certified nurse midwives to reach those underserved populations. So everywhere you go, there are Frontier Nursing University nurse midwives out there. I chose Frontier Nursing for its history. It is the largest producer of nurse midwives in our country, and it comes with just a rich history of serving underserved populations in rural communities.
Mary Breckenridge was our founder, and she was a nurse and later a nurse midwife who wanted to make a change for the people of southeastern Kentucky. And she wanted to do it through a demonstration project of how nurse midwives practice and what nurse midwives could do to change the health of a population. So she came here in 1925. We had no nurse midwives in the country at that time, or no nurse midwifery education program, so very few nurse midwives. She recruited about 20 nurse midwives over a period of 3 to 4 years, and they all came here and did primary care, community care, and maternity care in the families' homes. Of course, here in Leslie County, we had no roads then, so that was the mode of travel was on horseback, and so that was the famous Nurse on Horseback original history of Frontier Nursing University. So the ultimate mission of Frontier Nursing University is to educate nurse practitioners and nurse midwives to provide care to families, primarily in rural and underserved areas. Because of that, what we really want to do is recruit our students from rural and underserved areas, allow them to achieve this education in their own community, and return to that community and serve the families in their communities.
You will see that people who leave their community to go get higher education typically do not go back. And the research has shown is that if you educate someone in their community, they're going to stay there. And that's our goal.
We currently have students in all 50 states, and we also have a few in some foreign countries.
Frontier is a distance-based learning program, and so our students have time here on campus at the beginning of their program, but then spend the majority of their time working on their coursework or their didactic work in their own communities, from their own homes. Whether it happens in a classroom or from a student's home, it's the exact same coursework and same requirements for those degrees. This allows students to continue with their work, continue with their lives, with their families, and not having to relocate to receive the education that they are seeking.
I chose Frontier because I'm from a rural area in Kentucky, and Frontier made it available and easy for me to do in terms of distance. I didn't have to travel, and having a family and working, it just worked better with my life.
I still work full-time, and so I can come home after work and turn on my computer and do my schoolwork. I can wait till the family goes to bed at night and find time to study.
What I really like about this program is I actually have my professors on speed dial, or if I have a question, they actually step out of clinic and they will answer my question very fast, and I feel more connected with my professors here at this school, even though it's long distance.
So if Frontier was not in existence, I would not have had the opportunity to be a nurse midwife, because I was not a student that would be able to relocate and move to an area where a university was located, a brick and mortar school. Many nurses would not be able to complete that education.
We know that there's over 3,400 nurse midwives and nurse practitioners practicing right now in Kentucky. And this is just so important because Kentucky has so many health needs and does not have enough healthcare providers.
Right now there is a nurse practitioner and or a nurse midwife in every county in Kentucky. If Frontier Nursing University did not exist, there would be people in Kentucky that do not have health care. 11% of the individuals in Kentucky live in medically underserved areas.
So who is going to provide care to those people? We would have people who would not receive health care who needed it. I really believe that would be the result of that.
Those individuals would not have access to health care. There would be no providers.
Without us, without Frontier putting out more quality practitioners, the quality of care just wouldn't be there. The numbers, the providers wouldn't be there.
Then people don't receive medical care. If you don't have the ability via an automobile or funds to travel or to be able to pay someone, your medical needs go unmet.
We have time to build great relationships with our patients who want to come back and see us and feel very comfortable seeing us.
I would like to be able to, once I'm finished, to go back and work in that area again.
When they go home, they don't feel like they're out studying by themselves. They feel like they're part of something that's bigger than they are as an individual.
We need quality practitioners out there to reach the needs of the growing people, not just in prenatal care, but in all areas of health care. There's going to be more people who have access and more people who need it, so we need more providers out there.
Cancer. It's an ugly word, and it's even uglier when mixed with children. One Kentucky nonprofit is working behind the scenes to help kids that are undergoing treatment deal with the burden of fighting such a tough battle at such an early age. Let's meet Kids Cancer Alliance.
I realized that this is more than just a camp for some kids having fun. This is a family.
Our camp program started out 32 years ago. Started with a group of volunteers from the Kentucky Cancer Program. They actually came up with the idea of hosting a summer camp just for kids with cancer.
So they took it upon themselves, to put together a little camping trip. It's just by their wonderful work, they got it started. The people that go up there will donate a whole week of their vacation to spend with these children in July. Most of these people only get 2 weeks vacation a year, but some of them are actually giving half of it away just to spend with these kids. And many of those counselors are former campers, see? So you talk about credibility with the newly diagnosed children and their families and parents, that their counselor has been through this, that their counselors know what it's like to get this cancer diagnosis. They know what it's like to lose their hair or have some big scars, an artificial arm or eye. You know, when you come to our camp, kids go swimming, they're taking their legs off to go in the water.
And the bond that I see when these kids show up, they don't know each other sometimes. They'll come to camp and they'll get assigned a cabin. And then all of a sudden you can actually hear the volume start to go up. And the bond is now being made. And they're within a couple of hours. It's an incredible thing to witness. By the end of the camp, they're best of friends.
So we have 2 hospital programs that are inpatient. We have the meal program, which is going on now. That's when we bring goodie bags, volunteers, decorations, and a big home-cooked family meal. Typically, families come in, they eat with us, hang out, have fun. It just kind of gets them out of their rooms.
Sometimes it's almost nice to do this for the parents and the families and the nurses and the doctors who are rushing between meals to treat the kids.
The second program that we do in hospital is our camp-in program. We bring all of the traditional summer camp things that you would have at summer camp into the hospital setting. So we set up a tent, we make s'mores, which is really amazing to see the kids experience the same things they experience at camp and those friendships. We have seen the same thing happening and the same results happening in the inpatient environment. It is the unfortunate reality of cancer that some kids aren't going to make it. So when they come to one of our programs or our camps, we don't know if some of the kids are going to be there next year. On average, we probably have 1 to 3 children pass away a year. For any child who's passed away that year that's been involved in any of our programs, we have a closing campfire ceremony, and we release a balloon in the air and send up our well wishes and our love and support to them. And we also engrave their name on a wood pole that we have that comes to all of our programs, so that they're always with us and always a part of our family.
Well, in July of 2010, my then 6-year-old son, Adam, was diagnosed with medulloblastoma. And for these weeks that he's able to go to camp, he's just like every other kid. And he gets to do the same kinds of things that he would have been able to do had he not been a cancer survivor, but he gets to do it with kids who know exactly what it's like, to be different, to be bald, to have your life revolve around hospital and doctor's appointments. He doesn't worry about his spelling test. He worries about, are my counts high enough? And, am I going to end up in the hospital because I get a fever? It's so wonderful to know that there are people who get it, who understand you, who want to provide a service for your child and to have your child be able to experience normal childhood things.
I think if this wasn't available, for me personally, it would be a very, very sad experience. It would leave a huge hole for the state of Kentucky, for the city of Louisville. If this camp wasn't here, that hole would be enormous. And I think that this town and the state would really feel it.
It's a sad day because I think there's so much time that it just is spent sitting in a hospital room or in a bed, and if you can find ways to break it up, whether it be camp or coming in and having a meal with the staff and with other families and having that community, if that was gone, then you're just taking away any kind of light or joy that they might have to look forward to.
If Kids Cancer Alliance wasn't around, they might not be able to cope with their illness. They might feel alone, and I think their families would feel the same. They love Kids Cancer Alliance, and we feel like we're just one big family. So I couldn't imagine, not having that.
We are a huge part of these children's life, much more than just a place to go hang out for a week.
And I think it's important to count your blessings, and certainly Indian Summer Camp is one of those blessings.
You think it would be a really sad time. You think it would be, heartbreaking, but it is like the most inspiring thing ever.
Because that's what we strive to do, is give them back part of their childhood that cancer took away.
Did you know that every month a bunch of doctors, nurses, and volunteers get together on a Sunday and perform outpatient surgeries for free? Now that is the nicest of slices. Let's meet the medical professionals that are making a difference at Surgery on Sunday.
If you look across the country, 80% of the bankruptcies in the United States are healthcare or healthcare related. It's people that either don't have health insurance or they're underinsured and they just can't afford what they need to do.
You can see the number of volunteers that are here, and it's amazing how many people will give up their time to show up on a Sunday morning starting at 5:30, 6 o'clock and be here all day until people who have needs are taken care of.
This morning I'm doing what we call Surgery on Sunday. It's a volunteer service where everyone volunteers, including nurses, techs, surgeons, anesthesiologists. And we all come here today and we do procedures on patients who can't afford to have these operations done.
Dr. Andy Moore had a vision. And he knew that there were people who needed medical attention who weren't getting it because they couldn't afford it and they didn't have insurance.
Well, we'll do anything that you can do as an outpatient. So we do neurosurgical cases, ear, nose, and throat cases. We do a lot of general surgery cases. We do OBGYN, plastic surgery.
We do a lot of surgery and services for indigent populations at the hospital, but this is completely different. These are people that come to you, they're not acutely sick, but they have a problem that's affecting their daily life, and they have no way and no resources to get it fixed until it becomes an emergency. And then when it becomes an emergency, it's much more difficult to take care of and their outcomes aren't as good.
There's a several hundred patient waiting list. Just about a year ago, we had, I think, 700 people on our waiting list. But because of all of the volunteers and because we're now opening in other places, I think that list is cut in half.
When you do a case, there are probably 10 people that are making that happen. You have people that are cleaning the instruments. You have people that are setting up the instruments. You have a scrub nurse. You have a circulating nurse.
People that are at the intake to take down the information, to the people to bring you back, the nurses to pre-op you, and so forth. It's quite a significant amount of people that donate their time to do this on Sundays.
About 3 weeks out, you'll see the emails. We need anesthesiologists. We need this, and this. We're going to have to turn people away. And then usually about Thursday before the Sunday, okay, we're a full go. Everybody steps up.
I've got a pesky little hole in my intestinal wall, and intestines tend to stick out through that, so I'm having it fixed. When you have a loop of intestines sticking through a hole in the muscle, every step feels like you're being stabbed. Actually, I haven't even been able to work because I can't lift over 10 pounds. I actually would not have had much of any alternative. My only alternative would have been to try and borrow the money some way to get the surgery, and I seriously doubt I could have borrowed enough, so I don't think I would have had any other options.
My arm would go completely numb and hurt really bad, especially during the night, and 3 fingers on my left hand had gone totally numb. That would affect everything. You have no grip. You try to pick up a coffee cup and it would fall because you couldn't hold on to it. I don't have insurance. That would be so far out of my league and realm of finances that would not happen. I would have had to just deal with the pain. I just appreciate it so much.
And surgery is incredibly expensive, and most of the healthcare systems, the public healthcare systems, can't afford to do what we do here.
Well, if you look at the average cost of an outpatient surgical procedure, it approaches $30,000. If the state paid for the health care that we delivered, it'd be $24 million a year.
Some of the cases that we see come through here are just egregious. People who have had chronic illness for years who come out from surgery being able to walk, work, and function and have normal lives. So when you're restoring people to health, you're restoring the community. And when there's no one there to do that restorative work, then it affects the entire community.
There are so many people that I'm sure that this benefits. And without it, there'd be a lot of people that would be just in pain and would not have any kind of a life, because you can only live a certain way with pain.
If there's no more surgery on Sunday, we're going to have many, many more patients. They're going to be acutely ill, require emergency surgery or emergency health care that is going to potentially put them out of work. It may cost them their lives, and ultimately it's going to be bad for our state.
It's not just the physical, it's the mental, it's the emotional. Surgery is, it's all emergency for the person who needs it, and we take each case with that in mind. It solves people's health problems, and people leave here whole in ways that they couldn't be anywhere else.
I guess I should say, I should thank whoever set this little program up, because like I said, without it, I'd have had no options.
I can't believe that all these people volunteer on Sunday, give up their Sunday, and they're always so sweet and cheerful, and just, it makes you feel like you're not a problem.
There's always something somebody can do. There's always something that needs to be done.
We're all doing things that we do during the week, but if you look around here, there's nobody that feels like they're at work. Everybody has a smile on their face. There's a sense of brotherhood and reaching out to other people that can't afford it.
You've been given much, so you have much to give. So, this is something that we can do that's easy for us. It's just time, and so it's important to give back.
And this just makes them be able to live their life, and I think it's wonderful.
Wow, what powerful stories. And those are just a few of the agencies that are helping Kentuckians live healthier. I'd like to thank the people here at the Midwest Open for teaching us a little bit about cycle polo and hosting us here today. As for the rest of you, I hope we've energized your metabolism and created a desire to get involved with any one of our many nonprofit agencies providing health services, education, and support to our communities. Any way you can help is a big help. So go for a jog, ride a bike, or skip that soda, and just be aware of what it would be like without. I'm Brian Simmons, asking you to know more.